Well, it's Dr. Cameron. We're in San Diego at the ILADS meeting again, and Dr. Shore has just finished talking, or at least a little segment of his talk on the hyperbaric chamber, and there's so many people that are sick with Lyme and tick-borne illnesses, and so one of his areas has always been chronic fatigue, and then it moved to Lyme disease, as because Lyme disease and tick-borne illnesses was often part of the chronic fatigue patients he was seeing. And then he's also moving, will hyperbaric chamber be of use? And so he'll be treating people. He was reporting at the meeting today what his work has with hyperbaric chamber. Does it help the antibiotic therapy? So I wanted to introduce another guest who's a speaker at our ILADS meeting, and Dr. Cunningham is somebody that I've just got to know at this meeting, and she's a microbiologist and immunologist in Oklahoma, University of Oklahoma. But what's fascinating is she's working with PANDAS right now. But you know, I trained at the University of Minnesota. You know, learned about rheumatic fever, and she cut her teeth on rheumatic fever. And so has so much experience in working with that field. And now with that rich level of experience, she's taken on one of the most important problems of our day, which is what's happening to children. Why does strep affect them again? And now instead of calling it rheumatic fever, they're using the word PANDAS, which is pediatric, acute, neuropsychiatric disorder associated with strep. Mm-hmm. And they're even changing that name. So yes. Why don't we talk a little bit about your work?
All right. Well, of course, as I had mentioned earlier, I opened my lab with the study of rheumatic fever, and we thought that perhaps it was a pathway to studying autoimmunity, and at the time, no one was investigating it in the 1980s. And so in 1998, Dr. Sue Sweeto called me from the NIH and said, well, you've worked on rheumatic fever a very long time, and would you help us with this new disease that we've discovered that is caused by strep? And I'd done, of course, studied streptococcal sequelae since the 1980s. And of course I said yes, and we had a meeting, and about that time I had also seen a patient in the hospital with Sydenham chorea, and we had made human monoclonal antibodies from the patient, which is a technique that we use to take advantage of the patient's B cells, where we can actually obtain antibody almost forever. In making the monoclonal antibody, you take the B cell and make it grow forever and make antibody that you can investigate. And so we did this with Sydenham chorea and discovered that the antibodies actually signaled human neuronal cells and induced the signaling enzyme CAM kinase 2. It's a long name, calcium calmodulin protein kinase 2. But that actually indicates that in the studies that we've done, our research, very importantly, that antibodies in the blood actually can bind to receptors on human neuronal cells and cause increased dopamine release, which is likely to be one of the causes of the problems.
Let me go through that, a couple of questions. Now, Sydenham chorea, when I went to medical school, was a variety of movements.
Yes.
Sometimes rhythmic movements, and so it was. It seemed like that was history, that those types of tics, those type of movements, was in the textbooks and not going to ever happen again. So it sounds like that type of movement is here. And
yes,
a problem.
Mm-hmm. There are, from what we've been able to discern from our studies, in looking at the different antibodies that we investigate in our panel, that the antibodies to the dopamine D2 receptor are elevated in those that are similar to Sydenham chorea, but there are actually other subtypes of tics and OCD, or obsessive compulsive disorder. And actually, I should mention, because I think it's very important for our audience to understand, that Sydenham chorea isn't just about movements, that actually predating the movements of Sydenham chorea is a neuropsychiatric condition that oftentimes parents miss, because when there's the onset of the movements, it's such a drastic event that they actually forgot about all the neuropsychiatric changes in their children. And so this is very interesting, considering what we've seen with PANDAS, and that it actually may be a different type, as you were saying, of rheumatic fever.
Well, I think that often that's happening today, is that movement seen, or a tick, or something like
Yes,
that. And it's often easy, the doctor doesn't always ask, well, what's underneath the ticks?
Yes, exactly.
So with the PANDAS definition, they right away said, oh, it's more than ticks, that there's OCD issues.
Right.
But even past that definition, most PANDAS people have a fair amount of neuropsychiatric issues, or they wouldn't have called it neuropsychiatric issues.
Exactly. And even anorexia in 17% of the cases that Dr. Sweeto reported.
Well, I think that there's always a fair amount of anorexic kids around, and so the theory always is, oh, it's all a psychiatric base, it's family-based structure, so it's once again, it's worth looking a second time at whether there's actually a cause of beyond psychiatric. So
Of course.
it's good that you're checking on is there a biological cause, an illness that's leading to such an important thing for adolescents.
Right, and of course the panel of antibodies has expanded to have four different assays in these cases, where there are antibodies against either the dopamine 1 or dopamine 2 receptors, and both can be found in Sydenham chorea, but the D1, or the antibodies against tubulin or lysoganglioside, that comprises the panel of 4 antibodies. But ultimately, children are checked. When you look at their serum, then they generally do signal this human neuronal cell that we've studied for years in the laboratory, and it, of course, expresses some of the receptors that are signaled, and that's when we read the measure the activated or increased CAM kinase in those cells, then this helps us know that the antibodies are actually functional and potentially a cause of the disease.
Now, these tests that you're talking about, there's always tests that are developed for research, but often in practice, we're always thinking, wonder if I could order that test,
Yes.
and is it available?
Yes, actually, for about 1.5 years, we did a study that was approved by the Human Subjects Committee at the University of Oklahoma Health Sciences Center. And we recruited almost 1,000 patients, 958 to be exact, that signed consent forms. And at that point, we and the IRB committee there decided that we had enough patients to understand what was going on, and so the study was closed, and it took us approximately 1 year. That was at March the 31st, 2012, and by April 22nd, 2013, we were able to open a company called Moleculera Labs, and this laboratory tests for this panel of antibodies, the anti-tubulin, anti-lysoganglioside, and anti-dopamine receptor antibodies. And then we also provide the signaling test also. And that since that's become available, we've had up to this date over 600 cases that have been sent to us for identification of the antibodies. And of course, this does help with determining potential treatments.
With that test, how do you spell the name of the company?
Moleculera, M-O-L-E-C-U-L-E-R-A, just like a molecule.
Okay.
And it came from the idea of molecular mimicry between the streptococcus and heart, or between the streptococcus and brain, when we were investigating rheumatic fever.
And do the abnormal results, do they change with treatment?
They can in some instances, in other instances they may not. And because we have begun to kind of divide or subgroup cases of tics and OCD, there are those that are more chronic and those that are the acute onset, as Dr. Sweeto described in the first 50 cases of PANDAS. And the ones that are more like Sydenham chorea tend to have more of the anti-dopamine D2 receptor antibodies. And actually, in November, we will publish a new paper in the Journal of Immunology that actually will describe both the dopamine D1 and D2 receptor antibodies in Sydenham chorea and PANDAS, and try to and they will actually relate to some of the other data that have been out there in the field, so that it helps tie everything together.
Well, the peer review articles are really helpful to the field.
Yes,
so that's why probably all your experience with rheumatic fever and then all your experience now with PANDAS, I'm sure Dr. Sweeto's happy that you can bring it to that level of peer review where it really gets doctor talking about something so important.
Well, actually, she and I talk about it all the time to different groups, and sometimes we go out together. We've even been to Denmark together to talk to the Statin Serum Institute, who also uses our company. But she brings the clinical picture to it, and I bring the immunology to it, and so it's been a wonderful mix that we've discussed that really together we've been able to do it.
Now, what I find is that there's quite an overlap between the type of issues that someone with PANDAS has and those who have tick-borne illnesses.
Yes.
And so,
Exactly.
like Dr. Trifoletti and others in the New York area where I am, will often be involved with the same patients, and often, even though they used to treat with IVIG, is that intravenous immune globulins, that they find that antibiotics for strep might not be enough.
Yes.
So they often have had to expand into other antibiotics that we use all the time for tick-borne illnesses. They find that sometimes they have Lyme at the same time. So what has happened is that they've changed the name to reflect the change in how they look at it. So they call it PANS, or proposing the word PANS.
Right.
And that stands for?
Pediatric acute onset neuropsychiatric syndrome.
So it's still neuropsychiatrics, but instead of saying associated with strep, they know that there's other
diseases,
root causes.
Infections, other infections.
And the article that was published where they proposed changing the name is that they put Lyme disease on that list because they realized that instead of limiting only to strep, that perhaps the variety of bacteria that are in the tick might play a role in the whole PANDAS presentation.
Right, the Borrelia burgdorferi. Of course, there are many, many serotypes. There's so many that, I don't even know them all. But other infections, such as Lyme, are very important in triggering responses of the immune system that are very similar to those seen with strep. In fact, what I could say is that probably 15 years ago, we published a paper that was on Lyme disease, or in studies of the Lyme agent, showing the actual similarities between the Streptococcus and the Borrelia burgdorferi agent in the animal model that I was actually a collaborator, but we were very surprised that they actually shared epitopes and could bind to some of the same antibodies in rheumatic fever, for example.
Well, one of the doctors who came to the physician training program, Dr. Rhee, had finished the training program, and we happened to have a PANDAS patient who was getting better with antibiotics and doing a beautiful job. Went from thinking I was the worst doctor on the planet, yelling, angry, no school, nothing. I couldn't get out of a wheelchair, to being back in school. But it was a journey. It took a while. So we wrote a paper on comparing PANDAS with Lyme. similarities on clinical presentations, on lab, and that was published also. So I often find with that close similarity that many of the professionals who work with PANDAS and PANS are at Lyme conferences.
Exactly.
Some of the people who work with Lyme are at PANDAS conferences because we share common ground. We share patients with complicated illnesses, and it's a pleasure when they get better.
Yes, and it's so good that everybody is communicating. It's a wonderful thing.
Yeah, I would imagine that that dead and dying rheumatic fever actually turned out to have some value. It reminds me of years ago when Dr. Bergdorfer,
Yes.
who had been an old man, did a lot of work with, I think, rickettsia. And when they asked him to look at the ticks on Block Island and somewhere in the Long Island area, he said, well, there's spirochetes there. And he identified the organism in 1982, and that's when the papers came out. And so we don't call it Dr. Steer or Borrelia steeri, which, because Dr. Steer had described it in the 70s. They decided to call it Borrelia burgdorferi after he took all that knowledge and discovered the bacteria. So perhaps they'll name some bug after you.
Oh, I doubt it.
And then you can live on. Okay.
Well, I think they've named, my company decided to name the Cunningham Panel, so I guess it's probably an antibody
So you have been immortalized.
rather than a bug.
So what is in the Cunningham Panel then?
Well, the Cunningham Panel is the group of antibodies that I had talked about earlier, the anti-dopamine receptor, the anti-tubulin, and the anti-lysoganglioside, and the CAM kinase. But I think one thing that I did want to say during this interview is that we have, in preliminary studies, in my 1,000-patient study, we did have some people with Lyme. And I'll show tomorrow in my presentation some of the information that we gained, that Lyme patients with these symptoms of PANDAS or similar neuropsychiatric problems have these antibodies at elevated levels, almost at the same levels that PANDAS children with the symptoms have them. And we are investigating a group of 200 Lyme patients right now that were collected probably in the Northeast because they're from Columbia University. So those results won't be available probably until the first of the year.
Well, someone from the live stream asked that question. I don't know if you can give it out yet before your talk, but it said, what's the percentage of kids with PANDAS who have tick-borne diseases?
I don't know that.
Okay. But I think that the fact that someone that looks like a tick-borne, they order the Cunningham Panel, shows, again, the commonality of the mechanism, the exact things that are happening in this kind of illness.
It was a small, in our study, it was a small number, you know, maybe it was at least the ones, but of course our study was for PANDAS. When we originally set it up, and it ended up that the percentage, I'm trying to think, it might have been like 70 patients out of 958, so you can figure the percentage.
You know, I think
something like that.
I think the tick-borne illnesses aren't always so accurate in terms of they're not always sensitive. So even picking up that many, 70.
Well, I haven't counted them exactly, but that's
at least a decent number is worthy of further study.
Exactly.
And I think that the fact that we're all collaborating so well, it's going to just happen. We'll get real stats.
Right.
Here's a couple more questions from the live streaming.
All right.
Which, can elevated antineuronal antibodies cause seizures?
It would depend on what they were actually against, the antigen, because antineuronal, of course, is a very broad term.
Okay. And at what point do you have your child tested with the panel?
Well, of course, anytime you want to have your child tested, you can, as long as a doctor actually orders the test. But of course, if your child has tics and OCD and you're not sure of the cause and there are major problems, then certainly you would want to find out. And the reason is because if you have antibodies that are elevated, I always say where there's smoke, there's fire. And there's the inflammatory processes in the brain leading to neuropsychiatric conditions is such an important concept, because what's coming in the next age of science is that we will realize that many of these conditions that have institutionalized children and made life so difficult for so many because we didn't understand it really will be an inflammatory disease in the brain.
Well, I always find that, and I have plenty of children with tics, with all types of issues that overlap with PANDAS and PANS, and it's very tough on the parents on trying to get them to school, trying to keep their brain to focus and concentrate, because even though there might be a definition of tics and Tourette's and OCD, the obsessive compulsive disorder,
Yes, mm-hmm.
There's so many issues underneath it that affect education, and so it's a shame to hear so many kids that are being told it's a psychiatric problem, when this shows at least it's worth a second look at causes.
That,
Treatable causes.
Right, an immunologic problem. And, I can't say the exact percentage, but it's amazing that almost all the children that entered our study had elevated CAM kinase assays. We have at the company looked to see if there are any other types of antibodies that are present in those that are completely negative in all the tests. And we started with 2 of the serotonin receptors that are most common in the striatum, or caudate putamen. And about 25% of the patients that are completely negative have antibodies to the serotonin receptors. So we're very excited about that, and those will be added to our panel at our company very soon.
One thing that happened recently in the past couple months was someone who had been treated for PANDAS and had made some gains, and they took all the different antibiotics that a PANDAS or PANS professional would take. So when I looked at it from a tick-borne perspective, from that view, the only thing they really missed is that they hadn't been treated for babesia. So I got a call this past week that adding Mapron to this adolescent kid turned things around, and they were back in school again, and they weren't needing supervision at school, and it was like a different kid. And so that doesn't mean, I don't know what the stats are, but it's just nice on that one individual that with all the different antibiotics, that the one antibiotic came along and made a difference.
It was perfect, right?
So I'm going to close, because if I ask everything, you won't have anything left for when you give your talk tomorrow. So,
Exactly.
But I appreciate you being here and sharing such a wealth of information from spanning from rheumatic fever all the way to PANDAS and PANS, and who knows what's ahead. But the depth that you're bringing to the field is truly a blessing. Thank you.
Well, thank you so much for including me in the interviews. I appreciate it.